This is Olga Adler from Austin Businesswoman, and today we're going to talk about women's health. And my guest today is a medical professional, reproductive and pelvic health expert, also known as the vaginecologist, Dr. Teresa Irving. Thank you for joining us
Well,
today.
thank you. Thank you for having me, Olga. I appreciate being invited. It's an honor.
Thank you. It's an honor for us. Could you tell us a little bit about your background? How did you get into the journey of women's health?
Well, I'll try to be as concise as possible. Sometimes my husband tells me I'm not very good at that. So please certainly cut in. I'm not going to be offended. So basically, I started out as a nurse. And the reason I went that route is because I always said as a little girl that I wanted to become a doctor. But what does that really mean? I had no idea. Therefore, I thought, well, I'll go into nursing and it will certainly expose me to medicine. And at the same time, if I then find that I don't want to do that because I didn't know anybody who was a physician, I always will have a wonderful career to fall back on. And honestly, it really increased my desire to become a physician. And the interesting thing, though, is that when I went through nursing school, I said, I will never become a OBGYN and I will never become a psychiatrist. And that's exactly what I do, if you think about it, because women, we,
Yeah.
go through lots of different hormonal phases that affect our psyche. And I initially started out as an OBGYN. So I just had a very different experience during nursing school, which is what turned me initially against those two areas of medicine. So it's funny how, careful, careful what you say sometimes or ask for. In this way, it was kind of the opposite. Instead of what you're asking for, you get, right? Anyway, but I'm so thankful. So during medical school, um, I had been prior to med school, I was a CCU nurse, so an ICU nurse for hearts. And therefore, I thought I wanted to become a cardiologist and I want to become an interventionalist. So I want to do cardiac catheterizations and put stents into the arteries, et cetera, because I'm very familiar with that area of medicine and, life saving, right? But as I went through medical school, I discovered that I could not do 3 years of internal medicine to then go on to cardiology. And as I went through the rotations, I began to learn that I'm very much a hands on person and I like to do things with my hands. And I knew I wanted to become a surgeon. And when I went through general surgery, I thought, oh, this is what I want to do. But once I went through OBGYN, there was no doubt in my mind that that's what I wanted to do because I was able to mostly see happy, healthy women for the most part. And I could see them through all phases of their life. I also could be in different parts of it wouldn't be the same thing every day. In other words, I could do office work, I could do labor and delivery work, and I could be in the operating room. So to me, that was like the best of all the different worlds. And so that's how I started my career. But it became very evident that many of the things that I was dealing with women, labor and delivery primarily, but other things as well, is that the things that we naturally go through, at least for those women that have children, can often lead to negative ramifications in the future if not um, dealt with or prevented, or taking the correct actions to prevent a potential future illness, disease that really affects their quality of life and affects psychologically, emotionally, physically, the entire woman essentially. And so I became more and more passionate towards now really kind of going 360, if you think about it, from starting with the taking care of issues or taking care of women that have their babies, where the initial destruction of the pelvic floor begins, whether it's minimal to severe, and then going on now to what I really focus on is taking care of those problems that began early on. So it's been an interesting sort of path that I've taken, but one that I wouldn't change at all. The only thing I might want to do other than that is be a Rockette dancer, but I would have had to retire by now. And I'm a little vertically challenged, so that would have been another problem. Needless to
Well,
say.
you never know. As you said, never say never. Might still happen.
That's true. That's true. But I've done other forms of dance in the interim to help sort of alleviate some of that passion, help me be able to reach some of the goals that I wanted there. But going on to how I ended up where I'm at, I guess that's kind of the most concise way that I can come up with telling you how I ended up there. So, any questions on that?
Well, I have many. And so the first would be you said that first you thought that you would never want to become an OBGYN
Mhm.
and you would never want to become a psychiatrist. And now those are the things that you do. So, what um, stereotypes or misconceptions did you
Mhm.
have when you were saying that versus when you actually went through that and became an expert?
Well, a great question. And I, to be concise, I skipped that part. So, sorry for my allergies. Well, when I was going through nursing
Texas.
school, I did my psychiatric rotation at our county hospital, this was in El Paso, Texas, and it was quite large. And unfortunately, in those days, and we're talking about 25, 30 years ago, that both adults and children were being, if they were going to be hospitalized, they were in the same unit. And I mean, we all know it's very obvious that that is absolutely the wrong way to do things. But, again, I was being introduced to these things brand new, so I didn't know a whole lot more than it seemed very odd to me. And so, first of all, right from the get go, that's the wrong way. And then, I mean, this is graphic, and I hope it's okay for the audience, but there was an
Well, they
example.
knew what they were signing up for.
Okay, uh, there was an example that's very vivid in my mind, and I guess affected me negatively. So, and that is, there was a gentleman who was psychotic, and he took a chair and took one of the legs of the chair and stuck it up his butt in front of these kids. And I mean, what kind of impression are you setting? How are we being therapeutic to these children? So I just was very disgusted in a conceptual way, if that makes sense, besides the obvious way, right? And that's just one example. So there's many, but that's one example that's very vivid for me. And when it comes to OB-GYN, well, in nursing school, my very first rotation was obstetrics, and we had not even done the lecture components of it. So if that was your first rotation, you were required to read about it. Well, I'm kind of anal about being prepared. I cannot stand to not be prepared. So I read and read and read, read. Well, being a county hospital, and at that time, women were crossing the border from Juarez into El Paso all the time so that their child would be born in the States and they would have better quality of life. And I don't blame them, not at all. But anyway, point being is that we were super busy. And our very first day, we're being introduced and given orientation to the unit. Start trying to lower this, and where everything's located, et cetera. Learning who the nurses are, the nursing assistants, et cetera. And I'm kind of trailing behind because I'm watching and observing the patients, and then they all go into the next room. Well, lo and behold, this patient who's on a stretcher, basically in the hallway, not even in a room because they're so full they couldn't even get them in rooms, is all of a sudden screaming, pushing her baby out, and I'm the only one there, a brand new student,
Wow.
first day, and she pushes the baby out. I'm like, ah, what do I do? So I'm thinking in my brain, what did I read last night? And so I just grabbed a towel, tied it around the umbilical cord, and asked for help. But that was an immediate freaky situation, which again, having never ever been exposed to anything like this, was uh, wild. And but
I
I
can
love
imagine.
delivering babies. There's no question about that, except for the hours. But so those
Yeah.
were two little isolated events that were not typical, and unfortunately, led to this connotation in my brain that, oh no, I'm
Mhm.
not going to do that. Plus, I thought, ooh, cardiology, interventional cardiologists, those are studs. I want to be a studette in that. So, but it really wasn't ultimately my passion. So, yeah.
I see. And right now, you said that you transitioned a little from just labor and delivery to helping women who have pelvic issues later in life or
Mhm.
postpartum. So, if you had to describe your typical patient, who would it be?
Well, so my official title, although thankfully they're changing that back again. So we all know it as urogynecology. So it's a subspecialty under OB-GYN. So you have OB-GYN, and then you have uh, four, now five different subspecialties under there. One being urogynecology, or female pelvic medicine and reconstructive surgery. Crazy, ridiculous name, which is how my online persona name came about. And just a quick little side story, and then I'll come back. And that is, so we've always taught our boys correct anatomical, um, correct anatomy. We never use foo-foo or pee-pee or whatever. It was always penis, vagina, etc. So our oldest son, when he was in high school and he was with a group of friends, they were talking about families, and somebody asked him, he said, "Hey, dude, what is it that your mom does for a living?" And, keep in mind, he's 15, 16 years old. He hears his mom talking about vaginas all day long. And he's like, vagynecology? So when he told me that
That's
story,
brilliant.
I thought, whoa, okay, that's perfect, because that's what I do. I take care of problems in the vagina. So what are the typical patients that I see? Loss of bladder control. And that can mean either you're incontinent or you leak uncontrollably, or you can't pee properly, or you pee frequently, urgently, even if you don't have a bladder infection, or you have pain. Your bladder has a lot of pain with filling or other conditions. So, bladder problems. Loss of bowel control, and that can be either you can't control your stools or you can't control your farts. You are constipated, so issues that are problematic down there, and loss of sexual function. And that is a huge problem that is often, I mean, thankfully now is talked about more, but still is considered taboo in so many realms of our world. But luckily, it's becoming much more discussed, and also we're learning so much more about the incredible sexual power of women. And but for so long, there's been such a huge discrepancy between male and female, well, penile and vaginal sexual function, and that is beginning to change quite a bit. But the problems can be from loss of or no sex desire or low sex desire, which begins very early. Because there's medications such as birth control pills, antidepressants that affect that quite a bit. And women that when they first have babies and such, that's huge, where they don't really want to have sex because they have all those demands, and they just don't feel as good. And then going
Yeah.
through menopause, so libido, and libido really, or sex desire, begins up here. And if we don't understand that and really address those issues first, then it's hard to improve it. But also the inability to become aroused. So, becoming, having, the vaginal secretions being formed, all the different responses that happen with arousal, as well as orgasmic potential, whether it's never having had an orgasm to delayed orgasm to inability to achieve multiple orgasms, and just understanding what that even is. So, loss of sexual function. Another one is sagging vagina, which is basically pelvic organ prolapse. So things are starting to drop, whether it's the
Mhm.
bladder, the urethra, which is our P tube, the vagina, the top of the vagina, if the uterus has been removed, or the uterus, if the uterus is still present. And the rectum can also start to protrude into the vaginal wall and start to drop. And then the perineum, that's the area between the vagina and the anal opening, that begins to also herniate, or the muscles begin to pull apart, just like your rectus muscles get pulled apart when you're pregnant. And many times they do come back together, but the perineal muscles don't always, because you're always standing, coughing, or exercising, putting all the pressure on those
Mhm.
muscles. So sagging vagina, and then so five main categories. The fifth one being pelvic pain, and pain is
Mhm.
encompasses a lot of different things. So those are the kind of conditions that yeah, that I deal with day in and day out.
How common is it for women who have children? Is there any statistics saying that, say, 6 of 10 women would have either um, incontinence or some perineum prolapse or some other problems like that? Or is it more of a rare case?
Oh, I wish it was rare. Although I guess I would have less business, but honestly, I'm way too busy when it comes to treating the problems. And I do want to get to that point about treatment versus prevention, because it's what's really driving me now. So how common is it? It is way too common. So right now, I have often quoted that more than 50% of women will develop bladder incontinence, urinary incontinence, pee in your pants problem at some point in their lives. And that's ridiculous. So you or me is going to develop that problem, statistically. But guess what? It's actually 60% now. The latest study that came out in January shows that percentage has now gone up to just over 60%. That's crazy,
Wow.
right? So, and pelvic organ prolapse, about 25% of women will end up having surgery for prolapse of any of them. Many times I'm actually fixing several at one time, because it's less common to have only one thing falling.
Hmm.
Most of the time they happen in conjunction with others. So
Oh.
now, going back to prevention. So there are only around 1,500 urogynecologists across the United States, and with you can do
That's
your
very
math.
few.
Yeah, that it's just not enough. And if you do the simple math, will tell you there is a huge shortage. So how can we address these issues with the current situation that we have now? Well, that is prevention through education. But here is my biggest problem, and one that I get discouraged about, and I'll explain later how my husband helps me with that, because he knows how much I want to help. So, if you don't have a problem, why are you going to listen to me, right? Why are you going to listen to me about how to prevent it? You don't have a problem. I mean, that's the general attitude. And so it's hard to get someone to do things to prevent them when it may require a little bit of time and effort, when you don't, it's not a pain point for you right now. Right. And, I compare it to weight loss. So we see, people, we all know that maintaining your weight at an ideal weight, whatever that is for what academy you're studying, or et cetera. But we know that having a normal weight and leading a healthy um, activity level in your life, exercise, diet, et cetera, is important and does improve your quality of life psychologically, physically, emotionally. And we know the many multiple diseases that are out there that result from simply just from being obese, overweight, etc. And it doesn't mean that everyone who is obese and overweight are going to have those problems. But point being is that it's more likely to happen, right? And we learned that through COVID,
It's a
right?
risk factor.
What happened with COVID? So that is not so evident when it comes to doing the proper diet and exercise and other things. in your life to prevent pelvic floor problems that are really, really create a lot of havoc. And a lot of it, of course, is because these things are still taboo, even though they're certainly talked about much more. But it is not so out there in your face like things about weight, you know.
Mhm.
And interestingly, no one ever talks about that, well, first of all, we all know that weight is a risk factor for COVID, and the negative ramifications that result from COVID. We all know that. But did you know that um, people that had COVID have a greater risk of developing overactive bladder? Or did you know that if you have overactive bladder and then you got COVID, that it gets worse? So that's
People
not really
don't talk
talked about.
about those things.
No, of course not. So there's so much that we don't talk about that is so important. And just just on Wednesday, 2 days ago, and then thankfully this doesn't happen every day, but myself and two of my medical assistants were peed on by one of three patients. I got peed on by one, and then they got peed on by the other two. And the patient didn't do this on purpose. It's just what happened. In my case, I was doing her exam, and I do a very specific exam to look for prolapse. I look at each compartment of the vagina, et cetera, and then I have them do things like cough and push. And unfortunately, I usually know for the most part how to protect myself, but this was a big surprise. And this poor lady, dear sweet lady, who's in her early 40s and just shot out a huge gush of urine, which was unexpected.
Wow.
And she had just emptied her bladder. So I am seeing, we are in the midst of seeing these poor ladies in pretty bad conditions, and they don't have to be that old. But
Mhm.
point, I guess I'm being redundant, just saying that it's just not something
No,
that's
you.
talked about a lot. And I think that the most significant way that we can affect and improve that condition is by education. Education is the best medication, and prevention. And I've dedicated the last several years toward doing that. I've spent hundreds of thousands of dollars of my own money to create videos, to create all these different um, core, just a lot of stuff. And I get disappointed when I don't see people taking advantage of it. But what I was saying earlier that I wanted to mention about my husband is he sees how I think, gosh, why are why aren't people doing this? Why aren't they listening? They're just simple things. And he says, Terry, um, don't forget what you do every day. And this is my husband's words, you are a great surgeon. Patients love you. They thank you for what you have done for their quality of life from what you do day to day. Don't forget that. And I guess because I can only help one person at a time. And so my goal is to be able to help so many more. So right now, I am able to help many a little bit. I'm able to help a lot of it for one at a time, which is still wonderful. And um, I mean, that is by far one of the best parts of my job is the immense gratitude that I get day in and day out. And I can't not forget that. And so I have to remind myself to remember all of that gratitude that I do get because I am helping a lot. And then, I teach other surgeons to operate. And I also, I'm thankful to have medical students, not all the time, but a fair amount where I can expose them to the things that I do and educate them so that they can also educate others, no matter what field they end up going into. So, did I answer your question?
Yeah, and I actually, what you're saying is exactly correct because I became a mom a few years ago, and until that point, I didn't know how many women had problems with incontinence or other pelvic problems because they're only being discussed in moms groups, in communities for mothers on Facebook. People don't talk about these things, but it's as common as, you know, cavities, for dental issues. But we all say that, well, we should do our dental hygiene so we don't have problems in the future. We know that we are supposed to put our sunscreen on to prevent our skin problems in the future, or we're supposed to have a good lifestyle so we don't have weight problems or health related heart problems. But for some reason, it's, as you said, it's a taboo to discuss anything that's about pelvic, the sexual, reproductive health. For some reason, we still have this, curtain that prevents us from sharing it with the world. And I think what you are doing, your education, is a great way to raise awareness about this problem, about showing how common it is, and it's okay to talk about it. You don't have to just discuss it in a closed circle. It's okay to talk about it and prevent
Yeah.
it if you can.
Yeah.
So,
Yeah.
how
I
can
mean,
people learn from you? You said that you created courses and videos. How can people access them?
mhm. Well, I have my social media handles primarily being TikTok, YouTube, sorry, TikTok, Instagram, and Facebook. Have several little, videos on various pelvic floor issues, but uh, and then I have a website where there are some downloadable PDFs that are free for educating on various specific categories. But I did create a course that has all of the um, basically a very comprehensive course that puts it all together into one area. So, there's several lessons with simple activities, fun activities that um, put it all together, and some things that people are not aware of. Actually, many are not aware of in terms of how to either prevent or improve the current situation that involves all of it. Bladder function, bowel function, sexual function, um, sagging vaginas, etc. And so that's where I put it all together into one area. But you don't have to pay for that course to get the information. It's just not all going to be concise. But there's lots of free stuff that I have created on those social media handles, like I mentioned, and the website. The website
Thank,
being the Vagina
thank
College.
you. You have a big following on Instagram. I didn't see your TikTok, but I think it just shows how many people actually need your advice. And maybe they don't want to share this information with anyone else. But I think we all should do that, because if we don't prevent those issues, they only get worse.
Yeah.
And just denying them doesn't make it better.
Hmm. Yeah.
Um, uh, is that course for medical professionals, or is it for, everyday woman,
Oh, for sure,
women?
everyday woman. Yeah. I have
Okay.
not. I'm actually going to create one that's more geared towards medical students, residents, and physicians. But for now, this is just for every woman. And the thing of it is, it's hard to. I mean, you understand it now that you've had a child, and whether or not you have the symptoms that you've gotten on the different Facebook groups or whatever groups. But I initially, which is the wrong approach, but I initially started with TikTok because I thought, you know, the teenagers, the early 20-year-olds, when it was, 2, 3 years ago, where it was a little bit more geared towards the younger audience. Now every age gets on there, which is cool.
Hmm.
But the reason I went there is because I thought I need to impact them and have hopefully get them to do these things preventatively before they get pregnant. Because in my course, I also talk about what to do during pregnancy, during labor and delivery, especially how you can minimize the pelvic floor damage. Because, the number one risk factor is going to be having babies. Well, we need to have babies. So, what do you do if you're going to have a baby so that you can, limit the amount of problem destruction, etc. So anyway, I started on TikTok, and that really was the wrong place because that's the last thing they're thinking about. But it's okay. I've gone on. I still post on TikTok either way. But the reason I wanted to not only to prevent before they get pregnant, but also the number one athletic sport that leads to incontinence is what? What do you think? Yes.
Um, Running. athletics.
Close, close. Marathoners is number 2. What did you say? What was the other one that you said?
Chess,
Huh?
athletics.
Athletics, but
I don't
what
know.
other
It's
sport?
a little too general.
Yeah,
Well, I don't know. I intuitively think something that's a lot of cardio exercise, running or maybe weightlifting. No?
that's close. So,
Okay,
and
I give
it's
up.
not going to be just weightlifting. It has to be heavy, heavy weightlifting because,
Hmm.
small, light weights or body weight exercises are excellent if done properly.
Hmm.
So the number one is volleyball. Volleyball is the
Really?
number one athletic sport in women that will lead to incontinence. And it's
Why
because
is
of
that?
the impact, because they're constantly jumping up high, landing hard. They're doing a lot of what we call Valsalva, a lot of pushing types of
Oh,
moves repetitively, and so that's why. Anyway,
yeah. I
I
think it's
forgot.
important to know. I'm sure a lot of women who are into that sport, they don't even know that
Mm-mm,
they are running a high
they don't.
risk. And you said that you've chosen the wrong platform, maybe TikTok. But I think
To
if
start,
you grab the attention even of one young woman who didn't think about it, it wasn't on her radar, but then she was like, actually, I'm gonna look into that. You already achieved a lot with that because
yeah,
it's important.
yeah. No, I
Um,
know ultimately. I want to reach more. So
Yeah, and I'm we'll try to do it. We'll try to raise awareness and spread the word and tell people that it's okay. It's not something to be ashamed of. It's not something that you should keep away from your attention, you know. You should
yeah,
definitely think about those things because even women who don't have babies, they're child free. Menopause is 100%. All women will go through
mhm,
menopause. So it
yeah,
doesn't hurt to learn what
yeah.
you what to expect.
I
Um,
would never have thought that someone who didn't have a baby that was not menopausal would have problems, and I see it every day. So
yeah,
it is not only for women that have had children, it is for all women. Like I said, 60%. So not, 60% of women, not all, I don't even know what that percentage is, how many have babies, but um, it's all walks of life. Just there's lots of different risk factors. That's just the number one. We all just know about that. But yeah, anyway, thank you for making that point.
yeah. And I to conclude our discussion, I would like to ask you one or two, a few tips to help women improve their quality of life or pelvic health prevention measures today. What can they start doing?
Sure. I'm going to be an imposter and talk about preventative measures that my very dear friend and expert pelvic floor therapist, who I refer many people to, who is amazing, and her name is Tiffany Lee. She's got a lot of tricks up her sleeves, but I'll mention a few. And one would be okay, so we all know we should drink water, right? And
Hmm.
before giving the tip, I want to explain something, and that is when women start to have overactive bladder. So overactive bladder means they're going to the bathroom frequently, and or they always feel the urge to go, even if there's not much in their bladder, and or they leak with that sudden urge where they gotta go, or they're not going to make it to the bathroom in time. So you only need one of those to meet criteria, and going frequently means more than 7 times during the day. So, if you're
Hmm.
awake 16 hours a day, that means if you're going 8 times, that's every 2 hours. So if you're going every 2 hours or less, every 2.5 hours or less, um, that would be considered frequency. Okay. And it's not strict, it's just mostly that's generalized. Um, Now, in saying that, so we say drink lots of water, right? Because that's healthy for your
Hmm.
body. We know it nourishes all of our body. And what is the number one organ, or I should say, what is the largest organ that we have? The skin.
Skin.
and the
Mm-hmm.
vagina is skin. So all of that, the vagina, the skin, that's the last organ system that gets water, because you gotta feed the most critical organs that keep you alive: your heart, your kidneys,
Mm-hmm.
etc., liver. So therefore, they're the last ones, because for the most part, we don't have to have those under tip-top condition, the skin, that is, to or at least under the best condition. So, needless to say, they get the last of it, and we need to keep those body systems nourished. So, when we say drink lots of water, well, when women start to have overactive bladder, what do? They start to drink less water. Well, this is
Mm-hmm.
counterintuitive, but what happens is then your urine becomes concentrated. Well, that concentrated urine is very irritating to the bladder. So that's going to cause your bladder to want to contract it out and push it out. So guess what? Now you're drinking very little water, you're producing very little urine, and you're still leaking, or if you're not leaking, you're in the bathroom all the time. So you're actually doing a complete disservice for yourself. So reduction in water should not be occurring. Now, in saying that, when you drink the water, and this is where Tiffany Lee's tips come in, is don't guzzle it down. Don't drink a whole bunch all at once, because that
Mm-hmm.
will cause you to have to go a little sooner than you would have if you would just sip it. So sip your
Mm-hmm.
water all day long, and ideally, 48, ideally 64 ounces of water. Although there's not really a concrete specific amount, but that's a good average to be consuming. So that's 2 to 3 liters a day, but sipping it throughout the day, and that way you're not having to go as frequently as some women do, just because they guzzle the water down all at once. Then another one would
Oh,
be
a
to
little question. It's a big trend these days to say that you should drink a glass of water in the morning first, or like even 2 glasses. So that would be under that category of a risk factor. You shouldn't just drink it all at once, right?
Well, you can. I mean, while you're getting ready, you just have your glass of water with you. And, if it takes you 30 minutes to get ready by the time you brush your teeth, comb your hair, if you put makeup on or put your clothes on or whatever it may be, that's fine, because you're not taking 2 minutes or 1 minute to drink it all at once. Makes
Mm-hmm.
sense? So
Yeah,
no, definitely drink that glass of water in the morning. I mean, you
but
actually
not
could,
all in one
well, yeah, not in a minute. So,
chug. Mm-hmm.
mhm, exactly. Then another tip would be to discontinue drinking fluids. Um, we usually say, so if you have a problem, 2 hours before bedtime. If you don't, maybe about an hour. And if you have to take medication, just a little sip of water, because then you're going to be more likely to be up throughout the night. So those are a couple. And then one more, just to kind of make it an even odd three. And that would be to avoid bladder irritants. So earlier I mentioned that the concentrated urine is an irritant to the bladder. So what else causes the bladder to become irritated and want to, contract that urine out? And there are specific ones that are commonly known. Caffeinated products, especially coffee, is very notorious for causing you to want to go to the bathroom more frequently. And many of us already probably knew that, but didn't really maybe necessarily put two and two together. And this is not to say, stop drinking coffee. This is to say that. So I'll give the example of me. I consume every single bladder irritant, but I don't
Mm-hmm.
have a problem, and I also do the other preventative things. So, pay attention to these bladder irritants. Caffeine, anything caffeine, tea, coffee, sodas, or Coke, anything with caffeine. Any carbonated drinks. It doesn't matter whether it has caffeine or not. But if it has caffeine, that's a double whammy. Spicy foods, tomatoes, milk products, artificial sweeteners. I know it's terrible. Spicy foods and alcohol. So that's a lot. That's a lot to give up, right? And again, I'm not
Yeah,
saying give
but
it up,
as you said, in moderation. If you take them in moderation, it's fine.
or you can eliminate one thing. You can do it one of two ways. You can eliminate all of it and introduce one thing at a time and see if it causes the irritability of your bladder, or you can give up one thing at a time and see if there's difference that occurs as a result of that. It's not the best way to do it the second way because, but it's probably easier to do because most people don't want to give all of it up at once.
Mhm.
So anyway, those are
Too
a few
shocking.
tips. Thank you for Tiffany Lee.
Yeah, those are great tips, and I'm sure we all should know them. And thank you so much for sharing.
Yes, you're welcome. My pleasure.
And thanks for joining us today. Any final thoughts? Any final wishes for our audience?
Well, yes, sure. I hadn't thought about that, but I did just now. So that would be anything that you learned today. Um, think about someone that is a female and go and tell them maybe one of these tips. It doesn't have to necessarily be the three that I just mentioned, but it can be anything that you learned today that you found to be impactful. And find a woman of the female gender and uh, talk to her about something that you found to be valuable. And if she wants to learn more, then there's a recorded video here. But just do something. We often have these things on how to um, improve self improvement ideas. And one of them is to do something kind or helpful to another. So here's one.
Perfect. Thank you so much. And thank you for sharing the information, for spreading the word, for raising awareness on this topic, and for helping so many patients every single day.
Thank you. I appreciate it.
Thank you. Bye, everyone.